can see he's a little bit out of it. Back in the end zone, it's caught. It's Tommy Sweeney with a touchdown.
I was on the turf, woke up looking up, and nobody really knew what happened.
I don't think this is increased risk of sudden death. It's something else.
Hypertrophic cardiomyopathy is one of the most common inherited cardiac diseases and one of the most frequently missed.
Yes. 1 in 500 people, or about 0.2% of the world, have it. We miss it a whole lot more than we find it. So somewhere in the neighborhood of 8 or 9 out of 10.
For years, the answer was restriction, disqualification, career over. But medicine evolves, and the conversation has changed.
The days of uniform disqualification are over.
In this episode, you'll hear from NFL tight end Tommy Sweeney, who is publicly sharing his diagnosis of hypertrophic cardiomyopathy for the first time, and cardiomyopathy and sports medicine expert, Dr. Matthew Martinez.
Together, we'll challenge persistent myths, clarify what has changed, and define where HCM care is going.
Yeah, it was night and day. I felt better at 28, 29 than I did at 22.
Every problem has a solution.
Yes.
We just have to come up with a solution that fits you.
This is DoctoRx Unscripted.
Now let's get started.
So welcome to DoctoRx Unscripted, Tommy and Dr. Martinez. Today's a special episode. We're going to be talking about hypertrophic cardiomyopathy. But before we talk about any diagnosis or any sports, I want to get to know you, Tommy. Question for you.
Right.
In your spare time, what do you do? Like, what is your hobby? What do you enjoy doing?
It's music, guitar. I love playing guitar. Working on the vocals a little bit, but
Oh, wait,
the
you
guitar's,
sing?
well, I'm working on it, you know. but yeah, guitar, you know, I love listening, playing, and all that stuff, trying to get a little band together here, you know, on the side.
Oh.
Yeah, well, you know, early stages, of course. But
What kind of music?
kind of everything. I mean, it's, you know, rock and roll, but in a broad sense, you know what I mean? You know, get funk in there, get everything, you know, a little jam.
It's got an old school feel for sure.
Yeah, exactly, yeah.
So, I want to know a little bit about you in sports, because from what I understand, I'm a basketball mom,
Oh, cool.
but I'm learning
Yeah.
about football because my son is into all kinds of sports.
Oh, yeah.
So,
Bears?
Giants, Bills.
Yes. Mhm.
That is impressive. And I know it must have taken a lot to get there. So can you tell me what made you start playing football?
Yeah, just my dad he loved sports, and my sister's a couple years older, and she didn't play football, but she was playing basketball and soccer, and she was very competitive, and she's always really good. So, you know, I kind of took off after them, and I played basketball and football my whole life, and basketball was really my first love, you know, and but you know, they translate to each, you know, each kind of makes you better at the other, and football is great. And, you know, the team aspect of this true team game, I wouldn't say ultimate, all the team sports are really ultimate team sports, but it's really just a special thing in that locker room, and just fell in love with it and the guys, and played in college, and then, yeah, thankfully was able to keep going after that. Yeah.
So did you ever dream that you would make it to the NFLs?
That was the dream, you know, I don't know if it kind of seems possible, but, you know, you kind of almost didn't want to think about it. You know, it was definitely the dream. That was the ultimate goal, but, you know, it was kind of seemed so far at the time. And then, you know, as it started getting closer, started getting more realistic. It was like, oh, okay, maybe we should, you know. And thankfully I was with, you know, some great teammates. My parents were so great along the way, and they played for so many great coaches that really maximized what I could do. And certainly needed all that to get there.
To say Tommy Sweeney had a tough 2020 would be a massive understatement. The second-year tight end suffered a foot injury, and just before he was able to return, he was diagnosed with COVID-related myocarditis.
So take me to 2020. COVID hits.
Yep.
And what happened?
So that was the whole craziness. And I actually broke my foot in the offseason, and I was returning to play that season in Buffalo. I got COVID, and the return to play was the protocol. I'm not sure. It was you had to get an echo. Actually, you had to get an echo, and they saw something on the echo in the heart, and they didn't know what it was, so they had me wear a Holter monitor for a month. and it got a couple arrhythmias, I think is correct.
Yeah.
And so that was enough between the two of them, and it was just so new, and nobody really knew what was going on, so they just wanted to stay safe. So actually, they kept me out for the rest of that year, and just monitored it the whole time, got some MRIs, and there was, enough signs, I guess as a layperson, I don't know, but there were enough signs that it could have been a couple different things, so they just stayed on the safe side, and we monitored it, and they cleared me after that year, and I came back, played for those next 2 years in Buffalo, and then in 23, was down here with the Giants, and in training camp before a preseason game, just in warm-ups, not even doing anything, kind of passed out. I was on the turf, woke up looking up, and nobody really knew what happened, and we looked around. They did some tests and couldn't find anything. A week later, tried it again, same thing happened. And then they sent me to Morristown and found Dr. Martinez, and right in the spot, he knew exactly what it was. He got it all. Yeah. He had his theory, tested it, saw it, and presented me with the options. And
now his COVID story is pretty common, right? Okay. Where he went in for a, quote, return to play imaging, and we found something else. And HCM being one of those common something else findings. And at the time, it wasn't clear. He had some thickening, and he saw an expert. The individual he saw in Buffalo appropriately said, we need another expert, and saw someone at Emory. Jonathan Kim is an expert in this field, and saw him and said, I don't think this is COVID related. There's a little dot that they saw on the MRI of the heart. A little area that probably was unrelated to what happened with COVID, and said, but let's keep them safe, let's do a monitor, and then appropriately got you back on the field. And then, life took a turn and went to the Giants, and things changed again for him, where he had symptoms that were more concerning that kind of brought him to us.
Right. And just in terms of, first of all, is that story typical in terms of diagnosing HCM?
It is. It's not unusual for this to be stumbled upon.
Right.
And if you look at how often we find hypertrophic cardiomyopathy, we miss it a whole lot more than we find it. So somewhere in the neighborhood of 8 or 9 out of 10, we miss.
Right.
So we know that there's an opportunity to find folks and to improve their outcomes, the outcomes of their family, and hopefully to get them to return to the things they love to do, whatever it is. In this case, it happened to be professional football, but it could be simple things like just being able to walk on the beach.
Yeah. And in terms of symptoms, you said you passed out, but were there any other symptoms that led to that before you passed out?
No. It was just those two. There was a couple times I'd been lightheaded, but I just attributed that to, working out hard or whatever, tough exercise. But yeah, it was really just those two.
Also a familiar story, right? Hey, Doc, I'm older than I used to be. That's why I'm breathless. I'm not as in shape as I used to be. He's a professional athlete. So he's used to pushing himself to do things we can't do. That's how he became a professional athlete. Right? He can do things the rest of the athletes that he's grew up with, they fell off because they couldn't do what he did, and because he's built different, right? That's what my kids would say, he's built different, right? He's able to push through things and learn to live with being breathless and a little sore and tired and still pound through it. But the video of him passing out, it'll stop you in your tracks. Yeah. He runs a sprint. He gets to the end, and then he leans over and then falls over. He never actually went out completely. Right?
Okay.
So he'll tell the players that were around him said he was still coherent and never was out. No CPR. They didn't have to do anything to bring him back. He was, by his words, out of it. But they said he was still talking and looking around. But he went down like a ton of bricks. This is a big boy, and for him to go down, this is a significant collapse. Thankfully, he was wearing a monitor. So it really helped because we were able to see that it wasn't a lethal rhythm. Right. It was a rhythm that was just fast heart rate. And that's when I was able to say, I don't think this is increased risk of sudden death. It's something else.
Right. Once you got diagnosed, you went to Dr. Martinez, you got diagnosed with hypertrophic cardiomyopathy. What went through your mind at that time?
Yeah, it was because I'd heard it'd been talked about before, but I didn't really know much. So, it was kind of definitely shocking, but right away he was on top of it, and he was like, it is something, but it's something that can be handled a number of ways. And so, it was very calming right away, to be honest. And it was like, okay, I got something, but something we can do about it, so let's just go and do it,
Yeah. And in terms of how common it is, because a lot of times you hear it as rare, but then we know it's the problem is the diagnosis of it, but not how common it is.
100%. So it's really common. 1 in 500 people, or about 0.2% of the world, has this. So if you look, every continent has had a description of some version of hypertrophic cardiomyopathy. We think about 1 million people in the United States should have the diagnosis based on the 1 in 500. So it's really common. And it's missed not because people don't know what it is or because they don't, we have difficulty identifying it. We have difficulty recognizing it.
Got it.
We say it looks like some other disease, something that is perceived as more likely. But because this is so common, our message in the last 2 or 3 years is this is a contemporary treatable disease. We just have to identify it. And if we can find it, we can manage it. And that was the message I gave to Tommy. Every problem has a solution.
Yes.
We just have to come up with a solution that fits you.
So you were diagnosed with hypertrophic cardiomyopathy. What made you determine what's the optimal therapy or treatment for him?
So we obviously had to do a lot of testing to sort through this. There was a different cardiac imaging, and then we did what's known as an exercise echo, where we looked at his heart before he exercised and then looked at it when he was after. And he went a good distance. He exercised to the fullest, and to the point where, I don't know if you recall this, but you were actually leaning over on the treadmill saying, I think I got another minute. I said, I think I've seen enough. I think I've seen enough. So we took him off, and that's when we found he has obstructive hypertrophic cardiomyopathy, which is an important distinction, because the way we treat after we make the diagnosis is to determine, are you obstructive? Does the mitral valve prevent blood flow from leaving the heart muscle, or does it not? Are you symptomatic for some other reason? And that's important because the treatments vary. So we needed to know that, and the exercise echo was the key for that. And by the way, it explains why he passed out.
Got it.
So faster heart rates lead to worsening obstruction. When you don't have a treadmill to lean on, you fall over.
Right.
And that's what he did. So right away when I saw it, it's scary. It'll stop you in your tracks. But we said, let's make sure we completely identify what the cause is. And thankfully, we found a reversible, a manageable, a treatable cause. And then the discussion was, how do you want to treat it?
Yes. Yes. So what made you decide one treatment versus the other?
He explained everything very well, and the medicine seemed to be the most logical from treatment and, I guess, I don't know, ease or of use or whatever term it would be. And I think it was pretty, it was almost obvious, and just kind of took it,
So curious to know, so what options were there?
Well, complex discussion, right? So we give them what we've done for the last 30 years or more. We talked about open heart surgery and a durability of removing the extra muscle causing the symptoms. Trimming the valve and what we call plication of the valve would be a durable option for him, but required open heart surgery to do it.
Yes.
What would that mean for his football career? We wouldn't know until afterwards how well it went, how people perceived playing professional football after having open heart surgery with a chest that's now been opened.
Right.
Is a complex discussion. No one's ever done it. Right. And then there's other catheter-based procedures where I didn't think he was a good candidate for it based on a lot of things, but certainly based on his age, I didn't think this was a great option for him. And we talked about this drug. And the medicine we had seen firsthand it changing the way people were treated. We watched how much better they got on the medicine.
Yes.
The caveat for him was that, by the way, we've never used this at a professional athlete before.
Wow.
So we had to have that honest discussion with him about these are your options. This is a drug. We've not done it before. I'm willing to kind of walk you through this and keep you safe. Yes. So if you approach this from a place of saying, how can we create a scenario for return to play in a safe way, rather than saying, I want to look for a reason to disqualify, the outcomes are different.
Right.
So we were looking for a way to make sure we served Tommy best.
Yes.
And that was, can I play football? Can I do it safely? And if I can't, what does this mean for the rest of my life? Myosin inhibitors was the best option for him. And boy, has it been life-changing.
And then what happened after?
It did what it was supposed to. It feels great. Everything, it feels the heart, it's a normal heart essentially, right? I mean, again, layperson's terms, but but it feels great. and we haven't looked back. We got on it a couple months later. We were ready to roll, and it's just been awesome ever since. There's been no issues at all. So
we followed the rules, right? Got him on the drug therapy. We monitored it appropriately. And then we were able to do, at the end of all of that, a repeat stress echo to make sure that we had completely resolved this. And his pressure difference was well over 100, what we call the gradient.
Yes.
So a normal pressure
mean?
normal pressure difference inside the heart might be about 10 millimeters of mercury. People get symptoms when it gets to 50. Tommy's was exceeding 130 millimeters of mercury when he exercised. Wow. After 3 months, his pressure difference was about 18.
Wow.
And he could feel it.
Wow. Yeah. So pre-treatment and post-treatment, what was the difference in terms of how you felt?
Yeah, it was night and day. It was so much easier to get in shape. It was so much easier to stay in shape. It was like I had been kind of fighting against something I didn't know was there. And it was now, which is what I guess everybody feels like is a normal heart. And it was.
But you didn't even realize that was a problem before until you got relieved of it.
Exactly. And then it felt like, I was breathing great, an hour into things, and it was like, wow, this is completely, again, night and day, life-changing. It was literally life-changing. Yeah, it was. So
I love this part of the story because in an athlete, right, he's used to kind of pushing through what most of us would have just said, I'm breathless, I'm going to stop, I'm out of shape or whatever. We have the same discussion with older folks who are not professional athletes, and they say, I feel fine. They say it's normal. Most people can't walk up a flight of stairs, and I say, no, it's not. Right. And their families will help us guide that discussion. And then oftentimes we have to do some additional testing to really be objective about how breathless they actually are. People have trouble understanding and verbalizing what it means to be breathless, what it means to have limited exercise capacity. And sometimes you got to show them. And many times they don't know how bad they feel until we make them feel better.
Wow. So now I guess you're on treatment. How is now life after treatment? How are you in terms of sports, in terms of how do you feel right now?
It's great. Yeah, no, coming out of it was awesome. Was in the best shape. I was 6 years in, but felt better than I was my first year in the league. I felt better at 28, 29 than I did at 22. So, no, it's been awesome. Really, that's all I can say. It's just a completely different feeling, and just and it is everything. Even I used to if I got home, taking the dog out was like a whole extra thing. Now it's like I can do so much more. It's just so much less limited, I guess.
So let's talk about lifestyle modifications, right? So what are there additional things that you've been told that you need to do now that you've been diagnosed with hypertrophic cardiomyopathy?
For him, it's fairly easy, right? Yes. He's otherwise healthy, young guy. Yeah. But we're looking to make sure that all the other aspects of care are managed. So if you are obese, we have to figure out ways to lower the weight, because we know that being obese with this condition is worsening, leads to worse outcomes. If you have high blood pressure that's untreated, cholesterol, diabetes, sleep apnea that's untreated. So this treats one aspect of cardiovascular care, but it's just a piece. So all the other things have to be part of it. We spend a lot of time on hydration for whether you're a young athlete or an older athlete, but Tommy is already a healthy guy, so I don't have to worry about other diseases in him. But what I still find fascinating to me and a reminder is that people, even at this level, are still limited. And I love when he talks about how I feel better than I did 4 or 5 years ago. Right. How would this have had an impact on him earlier in his career? And then, of course, I think of the negatives, where if this medicine wasn't available, if we were required to do surgery on a 23-year-old, would he have even had a chance to play in the NFL? And the answer to that's likely no.
I know it's scary to even let people know that you've been diagnosed with a heart condition or any kind of condition. Yeah. How receptive now is the world of sports in terms of saying, okay, I may have a chronic condition, but now I'm back to my baseline or even better than when you first recruited me. How, is that acceptable now? Is it still scary to actually let the world know this?
Yeah, I think still scary, right? Yeah. Early on, we had a lot of education. We had a lot of phone calls with folks. Yeah. And what I say is that the days of uniform disqualification are over. And this is an opportunity to identify and risk stratify. And each team does it a little bit different. Each league does it a little bit different. So they've been more receptive than ever before. How we approach in the last 5 years is dramatically different than how we did it 20 years ago. And thank goodness for that.
Yeah. So, any advice again to anyone who's been diagnosed with a heart condition or any kind of chronic condition that's playing in the league?
Yeah, well, go to Dr. Martinez. It's a cool thing. It is scary when you first hear it, but I mean, I can't say enough about Dr. Martinez and how, he wanted to, not only did he want to treat it, he wanted to get me better, and he wanted to get me to play again. Like he's saying, a couple years before that, this medicine's not available. You're kind of in the business of keeping people off the field or, out of whatever, but he was in the interest of getting, not only treating it, but getting me back and playing and getting back to normal. And now, as we know, even better than it was before. Yeah. I don't even know what to say. That's just unbelievably amazing that it could change that much, and that there is hope and that you can get it treated and you can get back to doing what you want to do, whatever it might be.
I think the answer here is what we talked about earlier, where every problem has a solution, and we need to approach this from a place of trying to make people better. Yes. And then create a scenario for safety and for improvement of symptoms. And this is just one part of it, right? What Tommy goes through every year with me is a risk stratification to make sure that he's truly in a low risk category. Does he not need a defibrillator? We've screened his family members. We've talked about safe exercise practices. We talk a lot about hydration. We went through a time where when he first started on this, and he was dehydrated at some of the 2-a-days early on, and he would say, I'm feeling it now. And I'd say, you're dehydrated. Put a monitor on you, we're going to risk stratify you. But we talked about better practices for hydration. And so it's not just one piece of this, it's really comprehensive care. And that's what we think we offer that. So if you're an athlete, in the old days, we were looking for ways to disqualify you. But thankfully, those days are over. Yeah. Now we're looking for ways to make sure that we identify, risk stratify, and then create a plan for safety, which often includes return to exercise.
So then how do you create that safe space so you can have that conversation and not make an athlete feel afraid to actually tell their coach the diagnosis? Because, obviously you don't want to be sidelined, or you want to be able to play. Really important. Yeah. I'm hoping the message for athletes is that we're looking to work with them, the sports cardiology community, and I'm just a piece of it. There are many experts around the country. You heard about Jonathan Kim. There are others who are experts in the field who will work with you to find a safe way. Yes. For you to continue the things you love to do, as long as we think that we can stratify. If we find something that needs to be treated, we can treat it. And we have more treatment options than ever before. So when we heard his story, I said to him, this is what we're going to find. I just need the stress echo to prove it. And once we find it, we can treat it. And because we had done this before. So it's an advantage that I have, because I do all this every day, but I need help. I work with electrophysiologists and surgeons and interventional cardiologists, and we do this as a group. Right. This is a team sport for sure. What I do on a regular basis is just one piece of how we manage HCM, but it's part of a larger collaborative approach to how we handle athletes. I have many colleagues around the country that I call and ask for help. What would you do now? Am I doing the right thing? Right. Am I overstating this? And keeping ourselves honest. And I think that's appropriate. So, last question. What made you decide to come on this show to talk about your diagnosis? Well, the two things really, just how well it has gone, and just because Dr. Martinez allowed me to get back to sport and back to playing and doing what I do, and again, just living a normal life. I mean, I can't thank him enough. He's been so great and continues to be. It's like he said, from the beginning, it was like it's a big word, but it is a heavy word, literally and figuratively. But just from the way he explained it and what he knew and what we had to do, it was never scary. We were like, this is what we can do. This is what it is, and we did it, and feels better than it did before. And so I'm just, think everybody should hear that. And if they ever get this diagnosis, that not only is there hope, there's a lot of it. There's a lot of it to go back to your normal life. Yeah. And listen, I just want to thank you for coming on the show. Thank you. Because, I can only imagine people listening and the fear they may have if they've been diagnosed with something or have a symptom and don't know what it is and afraid to figure out more. The hope you've given them, right? The information you've given them, I think would work wonders. So giving them actually the ability, the hope to go back to their daily life if they get diagnosed, if they get managed the same way, if they form the right relationship with their doctor. So
nobody has street credibility like him, right? He's done it, he's lived it, and coming from you is so much more powerful than it is coming from me. So we are grateful that you do this.
Yeah, and grateful that you've allowed me to be in this position.
I mean, this actually also shows how important the doctor-patient bond has to be in order to allow you to live your life to the fullest. So again, thank you for everything that you're doing.
Thanks for having us. This has been great.
Yeah, thank you so much. Yeah.
Somebody tell me, just give me the guitar right now. Let's go.
Really?